Hello everyone, I'm Kiat from BP123, currently in Year 1 Semester 2. In today's video, I'll be doing a book review on this ebook named Patient Assessment in Pharmacy. What I like about this ebook is its practical approach to teaching essential patient assessment skills. The book is well organized and includes detailed explanations, making complex concepts easier to understand. This ebook is intended to fill the significant resource gaps in patient assessment that are needed by pharmacists to provide optimal patient-centered pharmacy services, including primary care. It also shows the reader how to integrate pathophysiology, medical history, physical findings, and laboratory tests to accurately assess and monitor patient problems. The focus of this ebook is on two major practice areas for pharmacists. The first is the management of patients with chronic diseases in the ambulatory care. The second is the community pharmacy setting, where pharmacists advise patients on self-care and counsel patients regarding their prescription medication for both acute and chronic diseases. So let's look at here. So the name of this ebook is Patient Assessment in Pharmacy, written by Richard N. Herrier, David A. Apgar, Robert W. Boyce, and Stephan L. Foster. So this book is separated into four parts, as you can see here. Part 1 is on the principles of patient assessment. The part 2 is on the assessment of symptoms. Part 3 is on the assessment in diagnosis and management of chronic diseases and their complications. And last but not least, part 4 is on the assessment of potential drug-related problems. So these are the four parts that exist in this ebook. So as you can see over here, there's the plus sign over here, and when you click on the plus sign, it shows the sub-chapters for every single part, and you can press this minus to hide them. So every single part consists of several multiple sub-chapters. As you can see here, they have a lot of subtopics. So part 1, the principles of patient assessment, is, as you can see, there is 6 chapters here. The part 1 entitled Principles of Patient Assessment covers skills needed to practice in both a chronic disease management role and a community pharmacy setting as a self-care advisors. Chapters 1 and 2. Chapter 1 is on the approach to differential diagnosis, and the chapter 2 is on obtaining a patient history. These two chapters focus on the pharmacist's role as self-care advisor in a community pharmacy setting, but also have applications for those assisting patients in managing their chronic illnesses. Both these chapters, Chapter 1 and Chapter 2, including the remaining Chapter 3 on documentation, Chapter 4 dealing with patients and healthcare professionals, Chapter 5 dealing with patient adherence issues, and Chapter 6 organizing patient visits. All these chapters focus on pharmacists involved in assisting patients to optimize treatment of their chronic diseases. This information will also be applicable to community pharmacists as chronic care management roles move from the healthcare system to the community pharmacy setting. So moving on to the part 2 on the assessment of symptoms, where we'll be having a lot of sub-chapters over here. All of these chapters focus on community pharmacist roles as a self-care advisor too. This information in those chapters is intended to assist the community pharmacy to optimize their role in the duties they are already frequently called upon to perform. For those patients not candidates for self-care, these chapters will provide knowledge so that pharmacists will be better able to explain the reasons why the patient needs to see their primary care provider or immediately proceed to urgent or emergent care. In addition to that, it will enable the community pharmacists to more accurately consult the patient on medications for acute illnesses, including what symptoms to observe to assess the efficacy of therapy and indications of potential adverse effects. However, these chapters are also valuable to pharmacists practicing in the ambulatory care clinic, also known as the inpatient setting, since many of these signs or symptoms can also be caused by adverse effect of medication. So we can see there is a lot of chapters over here. Just to name a few, there's cough, chest pain, heartburn, and abdominal pain. nausea, vomiting, diarrhea, constipation, headache, inflamed eye, and many more. And these are among the common symptoms for assessment to be done by a pharmacist. Moving on to part 3 on the assessment in the diagnosis and management of chronic diseases and their complications. We have 6 chapters over here, focuses on information for the pharmacists who assist patients in the management of their chronic diseases and their complication, as you can see from the title of this part itself. So we will have essential hypertension, dyslipidemia, diabetes mellitus, asthma, and chronic obstructive pulmonary disease (COPD), heart failure, and also seizure disorders. Moving on to the final part of this ebook on the assessment of potential drug-related problems. You can see here chapter 24 is on liver and renal disease, and chapter 25 is on anemia, bleeding, and infection. This part 4 is intended for all pharmacists regardless of the practice setting. Doesn't matter it's community pharmacy setting or even the inpatient setting. These chapters cover interpretation of laboratory tests that help detect adverse medication effects on hepatic, renal, and hematopoietic systems, or monitor patients with impaired function of these systems. Do I think this ebook suit the pharmacy program or any other program in IMU? I do think this ebook suits me as a pharmacy student because it provides a comprehensive understanding of patient assessment, which is a critical skill as a pharmacist. The practical approach and detailed content make it very relevant for students who are preparing for clinical practice, especially for the Year 4 pharmacy student. Additionally, this book focused on communication and clinical decision making, aligns well with the objective of the pharmacy curriculum at IMU, where we doesn't focus on studying only, but also focusing on communication skill when doing patients counseling or patient education, ensuring that all of the IMU university students are well prepared for our future roles as pharmacists in the future. And now, last but not least, I would recommend this book to all of my colleagues in the pharmacy course, as it offers a thorough and practical guide to patient assessment, which is invaluable for anyone pursuing a career in pharmacy. And if you guys have any questions regarding this ebook, or you need any clarification or reference, do not hesitate to come to us, part-time student library at IMU University. That's all from me for this ebook review on the patient assessment in pharmacy, and I will see you in the next video. Thank you.